Good afternoon, everyone, and welcome. We would like to turn the meeting officially to the chairperson, Dr. Brophy.
Hey, thank you. I'd like to call the meeting of the Board of Health for the City of Brockton to order for Thursday, July 1st. The first item on the agenda are the minutes for approval from the June board meeting. Any changes or issues from the other board members?
No, I move to adopt.
I second it.
All in favor?
Aye.
Okay, the minutes are approved. So next item on the agenda, the board has requested, we had requested some statistical data on COVID for the city of Brockton and on vaccination updates, percent of the population being vaccinated. So Dr. Monsoor, do you want to give us some information, please?
Yes, after the last meeting, I did send you some statistics, but the state sends it about twice a month. So I don't know if you wanted to get them on a regular basis also, but I did send you just one set of data after the last month meeting. So I can do that. I think we have another set either coming late today or tomorrow.
Okay.
But in terms of numbers, as of yesterday, basically we were at 1.8 persons per 100,000 people. In other words, 2 individuals per 100,000 in terms of average daily cases. And the positive rate is 0.71%. As of yesterday also, the we look at the total number of cases there were in the city. There were 11 active cases reported. So basically we're making progress. It's one thing that I keep, I think Dr. Herman, who is the medical consultant with the mayor and the Board of Health, myself, we tell people it's great news. The vaccines do work. However, we have to be optimistically cautious because we're not sure exactly moving into the fall what that will mean for us. And number two, there are many people who are not vaccinated who are very hesitant. Third, also we look at the Delta variant that seems to be spreading more rapidly and which is also more infectious than the strain that we had before. So with these, we don't know exactly what September will mean to us, but for now, we would say we are in a very, very good position statistically.
Any questions from the board members?
No, that's consistent
No,
with what
it's
we
very
were
good to
hearing
hear.
all over. Yep.
Yep.
Yeah, it's good good news that the cases are down so much in the city. So great job. So next item on the agenda is around the vaccinations, which obviously has been a continual issue for us. So updates on that as well. So I know you've scaled down the vaccinations to just one day and continue to vaccinate at various locations on Saturdays for now, and working with the community. How have the vaccinations been going? Are you seeing a decrease in folks or and people coming or involvement? Can you give us some background on how things are going recently?
Well, we continue to vaccinate, to offer the vaccines, and we this morning we had one business where we went to give few vaccines, and right now the 3 nurses, they are working at the Convergent Association at 595 North Montello. This is an ongoing clinic. Except for last Thursday, it has been consistently reaching out to over 50 people per day or per every time we have a vaccination there. So we want to keep that open. And we also want to continue to offer vaccination clinics at the Shaw Center, except that this Saturday, July 3rd, we will not have one because of the long weekend. And we think many people may be out to have some time with the family going away. So we don't offer a clinic. However, next Saturday, July 10, we will resume clinic there. The daily clinics with Brockton neighborhood has come to stop as of last Friday, the 25th. So basically, they will be there one day a week, and that's Thursdays. Every Thursday, they will be there from 9 a.m. until 7 p.m. So those are the standing clinics that we have. Beside that, we do have pop-up clinics throughout the community that we do thanks to DPH that has provided the service through the Yankee line, which is a mobile clinic. And speaking of mobile clinic, there is a Vax, they call it Vax bus. It's a bus, the Yankee line, that will travel from Pittsfield all the way through the Cape. And then they will stop at every municipality along the way. For Brockton, they will be here on the 11th and the 12th. So they will offer vaccination, and it's a great way to encourage people to get vaccinated. The other thing that the governor has done along with DPH, they have offered over $1 million, I think that's, yeah, over $1 million in the lotto for people who are fully vaccinated. I believe that today is the first day that people can start registering for it. And also there are 5 scholarships at $300,000 each for adolescents who have been fully vaccinated as well.
Yeah, great. So how is the city doing as far as vaccinations? Do you have any current estimate of how many folks, where we stand as to the population, the percent that have been vaccinated within the city, or?
There is some encouragement, but it's not 100%, and we're far from reaching 100%. We probably never will. Not to sound pessimistic, but we have over 53% of the population that has been vaccinated. 10.7% has received partial dose. So in other words, of the Pfizer and Moderna, they've received 1 dose. And then we have over 42% that have been fully vaccinated, meaning either from J&J or Pfizer or Moderna.
Okay. Any questions from any of the other board members?
No, again, we're doing reasonably well.
Yeah, that's a very good number. I just had one of these, like the bus coming through and these various things. How are you getting you're getting this out to the community, that these things are available through advertising or your community outreach, so that folks know that this is going to be happening, like on the 11th and 12th?
Yes, it's a partnership. Actually, the city advertises it, but also the state. It's on the state website, and they have a flyer they put out for the route where the bus will be traveling through. So for the city of Brockton, we do have the dates, the 11 and the 12 posted.
Okay, great. Okay. Any other questions?
Not for me. Nope.
Okay, great. And then as far as our van project, where do we stand with getting the van and getting it up and usable for the department?
Yes, good news is that we were able to allocate the money, the funding. So it's a little over 43,000 total. because we had to do some um, designing in it and putting it the way that we like it, with no seating assignment or no designing inside and outside. So with all that, it came to a little over 43,000. So I'm excited. The last week we received the title from the dealership. So we were able to go to register for the vehicle and get a plate. So it's like we almost there, but we don't have the keys yet. It's not. It's still being worked on.
Wonderful.
Great.
Well, go ahead, Greg.
No, I didn't say anything.
Oh, sorry. Well, I was going to say congratulations on that. It's certainly going to be of great use to you, not just in this vaccination, but, moving forward with even the routine flu vaccines, et cetera, that the Board of Health has always been able to do. It's nice to be able to bring the vaccinations out to various areas. So that's great news.
Thank you. Thank you.
Any other questions?
I'm good.
Me.
Okay, next item on the agenda is our nurses. So all the vacancies are filled now, and you have the 3 nurses up and working. Is that my understanding?
Yes, all 3 positions are filled, and we have all of them working right now at the Cape Verdean Association doing the clinic. 2 of them will be there until 7. 1 will be there until 4:30 because the protocol, or the how do I say that? Because of the probationary period, that person cannot put overtime yet. So she can only work up to 4:30.
Any questions, comments?
No.
Oh,
Okay. And then how about the reopening plans for Brockton, based on executive orders and sort of the mayor and allowing businesses to open, et cetera, within the city?
Yes, buildings are open. Government buildings are open. The Board of Health is open for business. It's been open all week. People walk in. Some of them, they still wear the mask, and we wear the mask, but it's been rescinded as well. And so, particularly for people who are fully vaccinated, they can walk without the mask to City Hall, which is also open to the public. But it's recommended that those who have not been vaccinated do wear the mask. Now, how that works out, I don't know if it's kind of an honor system. Nobody gets penalized or is asked to show vaccination card. So that's where we are. And so business is getting back to post-COVID or to pre-COVID, depending how you look at it.
Right.
Good.
And the individual businesses in the city are allowed to require their own requirements. So this is just the city allowing folks now to come in. Vaccinated folks are allowed to come in without masks. So okay.
Yes, and business they open also.
Yep.
I think a number of them, we go with what the state health department and Governor
Right.
Baker suggested, and that is each business can require customers like the market to wear the mask, as a layer of protection.
Great. Okay. All right. Great. Any questions from anyone?
no,
No.
Okay. Okay. And I think you've already gone through the statistics on the dashboard.
Yes.
So very nice to see that 0.0 point something 7.71. Really is quite an improvement. It's amazing. The vaccination is having such a huge impact, and such a great job in getting at 43% within the city. You're doing a great job there. So
Yes,
The next item
collaborative.
go ahead.
Sorry.
Councilman.
No, I was saying it's collaborative efforts. We have great team from the city, from the other departments within the city, the school department, the nurses, the school nurses. So it's really a team effort to come this way.
Right.
And it was on the TV tonight. I was listening to the TV, and it was a nice, thing about Brockton, how well Brockton has done from, being in the red and doing such a good job. And it was just on tonight. I was watching.
Thank you.
That's great to hear. It's a great job. All right, next item on the agenda is the health promotion and public health education. You've had a lot of support during the pandemic here, continuing through. Any updates or information that you can share with
Well,
us?
actually, yeah, we continue to expand. This week we call 128 businesses. These calls were made with reference received from the PIH, which is Partners in Health, that does contact tracing COVID investigation and contact tracing. So they spoke with those businesses and then encouraged them to call us or to, if they could, if CDC or PIH could give us their contact information if they're interested in getting their staff vaccinated. So we did make the calls. However, the reception was very low. And one caveat was that many business owners said that their staff has been vaccinated. So we found just a minute number of businesses that said yes, they want vaccination. And next week we have one church, one at 184 West Elm Street, that we will do a clinic for. And then the Westgate Mall is still open to us if we want to get vaccination there. And then we have some other clinics within the community as pop-up clinics, also in collaboration with the mayor's office and office of constituency, as well as with the blessing of DPH that has subcontracts with the subcontracted with the Yankee Line to help manage and man those clinics.
Right. Wonderful. So, any questions from anyone?
Nope.
Okay. So next item is next item is regarding resumption of in-person board meetings. Any information coming from the state? They're still allowing these virtual meetings, but any word on when it will be required to go back to in-person meetings or plans for the future?
The law department for the city through Solicitor Bridges has mentioned at our heads of department meeting this week that it's optional if people still want to do some virtual meetings, but officially all meetings should resume next month in person. I mean, it remains as kind of an open door, an option that people can call in, but officially it is mandated to that businesses meetings resume as in person, and also allow make provision for virtual.
A provision for virtual. Okay.
Yes.
All right. So does this mean that next month's meeting will be an in-person meeting? Is it the?
Well, I mean, it's It's the board's call, in a way, I suppose.
Yeah,
Doesn't matter to me.
so,
Do we have a meeting in August? I thought we usually didn't have a meeting in August.
That would be-
there usually is, yeah, 1 month in the summer that we don't have a meeting, but,
Yeah, this will be my first summer with you, so.
yeah, this is a summer where there's been a lot going on in public health. Dr. Andre, any thoughts on virtual versus in person? And
I mean, I think there's a reasonable, it's reasonable to start meeting in person again. I'm ready to go whenever everybody else is.
okay, all right. So let's try to plan on having the next, and we are we having an August board meeting? I think we should put it on the books with a plan for an in-person meeting. If there's not a lot on the agenda, we can talk about if the summertime is quiet, as it sometimes, and just canceling the meeting if there's not a lot to bring to the board at that time. But why don't we schedule the next board meeting for August 5th, Thursday at 4:30, to be an in-person meeting at City Hall. And I assume our usual meeting room will be the place for the meeting to take place. Is that correct?
The GR room?
Yes.
Yes.
Yeah.
Yeah, again, as George had mentioned, if we generally have been not meeting in August, if it is a light discussion, we can just postpone and move to September, at least from my perspective.
Yeah, so that's my perspective as well, that we just have it on the books and Dr. Monaco, so if it coming to the meeting, there's no action items or agenda items that the board needs to take, then we will cancel the August meeting and plan for the following meeting in September to be the first of our in-person meetings. But let's just keep it on the calendars for now, and a decision will be made later in August, just in case something does come up in the meantime, particularly in this time of COVID, just to be sure that we keep that on our calendars and are available for the meeting if needed. So does that sound like a reasonable? Good. Okay.
Yes.
All right. Any other items that members of the board want to discuss before we adjourn?
No.
All set.
So a quick meeting today. So do we have a motion to adjourn?
So moved.
Okay. All in
Second.
favor?
Aye.
A second.
Aye.
All right. So thanks, everyone, and I hope wish everyone a happy
Have a good Fourth.
And and please everyone stay safe. All right.
Yep.
Take care.
Thank you. Take care, everybody.
Yeah, thank you so much.
Take care. Stay safe.
Good July 4th as well.
All right. Bye-bye.
Thank you.
Bye now.
Bye-bye.